I'm Dr. Saranya Manikaraj, paediatrician and newborn specialist at Women's Center by Motherhood, Coimbatore. Today I'll be talking to you about what we call as newborn jaundice. So newborn jaundice, as you all know, is a very common thing that we see, and it is there in almost all newborns. This is not a disease or an issue or a problem. This is a natural phenomenon that happens in newborn babies. So in Tamil it's called Kamala. Kamala means jaundice. So why do newborns get jaundice? This is very different from adult jaundice. So newborn babies, they have a higher level of hemoglobin when they are born. So their RBC count, like you saw, red blood cells are what contains the hemoglobin. So they have a higher RBC count and hemoglobin content when they are born. And when this RBCs break down, which is a natural process which happens in all of us, so generally for us it breaks down in 120 to 150 days. But for newborns what happens is it can break down a little earlier. It breaks down a little earlier, and this leads to jaundice. Now normally when it breaks down and there is a component which is released which is called bilirubin, this is generally cleared by the liver in all of us. Again, in newborn babies, this liver is not completely mature. It is maturing, but it's not completely mature yet. So the liver is able to process the bilirubin or metabolize the bilirubin little slower than in adults. So these two conditions are the main reasons that newborn babies develop jaundice. One being having a high hemoglobin at birth, and the second one, their liver being a little immature. So this is a very natural phenomenon that happens, and almost all babies who are born will get their jaundice checked on day 2 or day 3 of life. And most often these jaundice levels are not worrisome. Anything which is not worrisome for a particular age and for a particular birth weight, we do not need to do anything about it. Very rarely some babies can have a little higher level. So when we say higher, it's not the same for all babies. It depends upon the baby's age at birth. So whether the baby is born preterm or term, the baby's birth weight, so whether the baby is a 2.5 kilo or a 3 kilo baby. So the levels can differ depending on all these conditions. So in case your baby's level is a little higher than what is to be expected at that particular age, your doctor will let you know. And most often it just requires a little bit of treatment which is called phototherapy. Phototherapy is blue light which is placed above your baby. When that blue light touches your baby's skin, the jaundice can get eliminated, can get reduced. So most often this is all that is required. And if the jaundice levels get down by even a day, your doctor might suggest to stop the phototherapy. Very, very rarely the jaundice level can be very high. This can happen in certain conditions, like when the mother has a negative blood group and the baby's blood group turns out to be positive, or when the mother's blood group is O positive and the baby turns out to be A positive or B positive. And in certain other conditions when baby loses a lot of weight, so when the initial birth weight, from the initial birth weight, when baby loses a lot of weight, again jaundice levels can go up. Again, it's important to understand that these are all very, very rare. The commonest thing is to have a very low level of bilirubin or a moderate level of bilirubin, which is jaundice. And most often, most babies eliminate it by themselves, and by the 7th or 10th day of life, the jaundice is almost gone. So we don't need to panic about this. Even if your if your newborn is getting a test done, talk to your doctor, find out what the levels are, and even if he or she needs phototherapy, don't panic about it.